Klein, president of Unity Consortium, and welcome to Powering Young Adult and Youth Engagement in Making Vaccine Decisions. Our focus today is on adolescents and young adults, and we have an outstanding group of panelists who will share their insights and all of their efforts about activating young people to ensure that they themselves, as well as their peers, are getting the well visits and the immunizations they need to stay healthy and be protected against vaccine preventable illnesses. The spotlight's been on COVID vaccines, just one of the recommended vaccines for young people. There are 4 other vaccines that are recommended to protect against meningitis, HPV-caused cancers, whooping cough, diphtheria, tetanus, and flu. And the latest data on vaccine coverage for young people reveals encouraging signs of improvement, though significant disparities remain, especially based on where a teen lives, household income, and race and ethnicity. And this means that sustained and innovative efforts, just like our panelists are doing, are really critical to ensure that all adolescents are protected against vaccine preventable illnesses. So for example, for the cancer prevention HPV vaccine, only 6 in 10 adolescents are fully up to date on that vaccine. For meningitis, there are 2 vaccines needed. Again, only 6 in 10 eligible adolescents have gotten the recommended 2 doses of meningitis ACWY, and only 3 in 10 have received 1 or more doses of the meningitis B vaccine. Both are needed. And about 7.5 million eligible adolescents have yet to receive 1 dose of COVID-19 vaccine, and this widely varies by state. So today we're talking about the challenges of keeping young people up to date on immunizations, and our wonderful advocates stand ready to share their insights and their strategies. We also want to hear from you, so please write your comments in the Q&A and share your experiences, and of course any questions. And I know Dr. Clinton will be monitoring them and sprinkling them into the conversation. So now it's my pleasure to introduce our panelists. First, we have Kelly Danielpour, who is an undergraduate at Stanford University and founder of Vaccine. Hi, Kelly. We have Ethan Lindenberger, who is a student at Lorain County Community College, a health and an immunization advocate. And we have Hirsh Shekhar, who is a student at Yale University Medical School. Hey, Hirsh, a graduate of the Clinton Global Initiative, as well as a health advocate himself. So now I am thrilled to once again introduce Dr. Chelsea Clinton, Vice Chair of the Clinton Foundation. Thank you, Dr. Clinton, for joining us for this important discussion.
Oh, Judy, thank you so much for having me and including me in this important discussion. It's always really wonderful to be with Unity, and particularly to be with so many young people who are working so hard to help ensure that their peers and really all of us are as healthy as each and every one of us deserves to be. So I'm going to plunge right into some questions, and think a good place to start would be at the beginning. And Kelly, I'll start with you, and then also ask Ethan and Hirsh to follow. And I'm starting with Kelly because you are next to me on my Zoom screen, not just because you're a Stanford student and I'm a Stanford graduate. I think it would be really good for the audience to just hear kind of what drew you to this work, to this cause. Why is this personally so important to you, and kind of how has your work changed and evolved at all, if at all, over kind of the recent months and years as relates to vaccines and vaccinations?
Thank you so much, Dr. Clinton. Yes, so I started with vaccines when I was 16. I was really interested in public health, and I came across a post on Reddit, actually. And it was from a teenager talking about how they really wanted to be vaccinated, and how this was sort of an issue with their parents. And I was really struck, not just by the fact that they were thinking about this. I think I realized that I had really taken having these vaccine promoting, I will even say, parents for granted, but also the concern they had for everyone around them. So in this post, it wasn't just that I want to be healthy, but it was, I want to protect my grandmother, I want to protect my classmates. And I think that's a really, obviously, it's an incredible thing. This is pre-COVID, and this concern for other people and the idea of really thinking beyond oneself, and considering vaccines in this way, in a way that now I think many of us do, obviously in this sort of COVID landscape, but before it is something that most people really rarely thought about. And so I was struck. And from there, I sort of dug in and I realized this was a question that many teenagers had and an issue many were facing. I also realized how much that sort of this issue of vaccines was in jeopardy. Obviously, there is this like growing vaccine hesitancy, widespread misinformation, and I just really wanted to help however I could. So that sort of was the origins of Vaccine. I think that has definitely evolved, especially with COVID and sort of how people talk about vaccines now. But at its core, it's really about engaging young people in this conversation. So whether it was starting those conversations, having people be equipped with the right information and facts and resources for when they come up. And then so obviously now that these conversations are very, very commonplace, making sure people know how to handle them and what to say.
Great, Kelly, thank you so much. Ethan, I wonder if we can now turn to you. So a similar set of questions, kind of what drew you to this work? Why is this so important to you? How has your work changed in recent months and years?
Yeah, thank you so much. I would say that my work really started in a very different place where I kind of made a personal decision for myself to be immunized. And over the course of a Rube Goldberg machine or domino effect of the internet kind of doing its thing, that turned into a public story where I was given the opportunity to advocate for that decision I made for myself and also advocate for the independence and autonomy of other teenagers and the importance they have in making their own health decisions for themselves and their community. So it started off as a very simple decision, something very personal, something interpersonal. My mom is an anti-vaxxer. I chose to educate myself and come out of that and to make that medically conscious, educated decision, while also maintaining a level of dignity and empathy for her, and that she was trying to do the best thing for me, was trying to be caring and watch out for my health, even though it was the wrong decision. She had the right intention. And that platform's kind of carried over all through 2019, where I was just advocating for a more empathetic perspective on misinformation, trying to address, how do we educate people rather than demonize people that think differently or are misinformed. And also, if you're a teenager, you really should get vaccinated because it's like, our health decisions impact our community and impacts our families and even our whole world. Like we can eradicate entire diseases, starting at the individual microcosm of you as a 19-year-old getting vaccinated. But when COVID happened and the whole world kind of started spinning in a different direction, vaccines became a very household discussion. It wasn't as much this taboo 2019 topic in the news where it's like, oh, what's this measles thing? Everyone was talking about COVID vaccines, which is good, but also a little dangerous because that means there's a lot more opportunity for misinformation to fly, a lot more opportunity for people to take advantage of those conversations and start selling things or misinforming or misleading people. So my platform originally was very much advocating for the empathetic perspective, advocating, for independence and for educated medical autonomy for young people. But now I focus a lot on the medical misinformation we see online and on social media predominantly. And I try and also still maintain that empathy of just because you have a family member who reposts this thing or has heard this thing and now they believe it, doesn't mean they're a bad person. And it's important that we tackle that, even though it's messy and confusing sometimes, but people still deserve respect. So in some ways it's changed circumstantially, in some ways it stayed the same. And I think it will always be that way because vaccines will never go away as an important piece of our medical cornerstone in society. Vaccines will always be a thing of contention. Medicine is always going to tackle with tough ideas and curiosity and skepticism. But we need to handle that with, I think, some courage, to do the right thing and take the higher road and be kind.
Great. Thank you so much, Ethan. Hirsh, want to now turn it to you. If you can please share kind of how you came to this work and how your work may have changed in these COVID-19 times or may not have.
Absolutely. Thank you so much for the question, Dr. Klein. And I want to start by really echoing what Kelly and Ethan said about wanting to help and wanting to be of service to the community. I think those are values that are certainly ingrained as a medical student, even from the first week of school, hearing about how our professors engage the HIV crisis and thinking about that duty first ethos. And to provide a little bit of background, I have long been interested in public health and advocacy and serving marginalized populations, and have been aware of the barriers that can prevent people from accessing healthcare, both from experiences I've seen in my family and also as a volunteer social worker. And so fast forwarding to spring of 2020, this was a time as COVID-19 was growing. Health profession students across the country were sent home from school. And yet many of these students wanted to help and really felt called to serve in this time of health emergency. And so I was back home in Minnesota, and I first became involved advocating for smartphone assisted contact tracing as a way that we could limit the spread. And I wrote a short op-ed advocating for a platform that ultimately was adopted by 5 US states, including Minnesota, my home state. And so from there, I started connecting with other health profession students who similarly felt called to serve, but many times did not know how to help, especially being sent home and away from the resources of the academic medical centers that we were, previously a part of physically and in terms of location. And so from there, recognizing this common experience that a lot of health profession students had, we launched and grew the National Student Response Network, which ultimately became a network of over 7,000 health professions students across the country who were interested in serving. And we were able to help place student volunteers with roles at clinics, county health departments, and community partners in roles ranging from contact tracing, PPE distribution, COVID-19 testing, to telehealth, logistics, patient education, healthcare worker support, and more. And as we were doing this work and seeing the impact that health profession students can have in supplementing the COVID-19 response and alleviating the burdens that we were seeing firsthand on residents and faculty members. I remember at this time, in the news, you would hear physicians who were working, 10-hour days, day after day, 16-hour days, day after day. And I think, seeing how overburdened the healthcare workforce was and seeing the impact that we might be able to have, we started thinking deeply about vaccination as well. We knew that COVID-19 vaccination was on the horizon, and we began to think about roles for health students. We felt the health students were uniquely positioned because health students are in general altruistic, eager, willing, and largely untapped at that point. And also, this was a time when we had physicians and health professionals coming out of retirement in order to serve on the front lines. And we felt that as a relatively young workforce, we were at lower risk to be on the front lines ourselves. And so out of that sense of duty, we spent a lot of time thinking about how we could help. And we ultimately settled on 2 main roles, which were to administer shots in arms and to communicate, especially for those of us who were home now in communities that for historical reasons may have diminished trust in the healthcare system, and may be communities where we can serve as initial trusted messengers. And so we advocated these 2 roles, and we're very fortunate that the Biden administration explicitly recognized these 2 roles for students, and also adopted our proposal of expanding the PrEP Act to enable health profession students to administer vaccinations across the country with liability protections that were previously being negotiated in a patchwork manner at a city by city level, school by school level. And so once we were able to overcome that obstacle of patchwork liability negotiations, we were able to deploy health profession students across the country to advance COVID-19 vaccination. I remember the day after the PrEP Act was amended, I and a group of students volunteered in the lobby of a public housing building in Boston. We canvassed, encouraged residents to come get a vaccine in the lobby, and we also had medical students, including myself, putting shots in arms And then from there, we placed one of our medical student leaders as the director of vaccinators for that organization and allowed them to scale up their work. We had other activities like designing the official postcard for the New Haven Health Department, going in-person canvassing and encouraging people to get vaccinated, helping with community healthcare vans, holding national information sessions and open Q&A to discuss reasons for hesitancy and help answer questions that people had. And I think through all of that work, it really reaffirmed to me the impact that duty-driven health profession students and students in general can have. And it all really stemmed from that feeling of duty and that feeling that, we are called to serve in times of health emergency. And I think that's something I really share with Kelly and Ethan, and something that a lot of students in this country have felt during COVID-19.
Well, Hirsh, thank you to you and to Ethan and Kelly for all that you have done and are doing. And I want to echo Judy's opening kind of request for questions, from the audience. We clearly have three, remarkable leaders here who are doing even more than I knew from reading their biographies to help keep their families and their friends, their communities, our country safe and healthy. All of you in different ways spoke about the need to ensure that people have good information both to help inform them and also hopefully good information to help inoculate them from the misinformation and the disinformation. And Ethan, I so strongly kind of resonate with your kind of admonition to all of us to kind of have kindness, compassion, kind of understanding for people who are navigating, more kind of more words about vaccines and vaccinations in the last 2.5 years than they had heard kind of in the totality of their, lives before COVID. I also, though, admittedly have quite a bit of frustration and at times when I'm not my better self, anger toward those who do know better and are promulgating a lot of that misinformation and profiting off of it.
Right.
I find it deeply troubling, kind of the profit engines that the social media platforms and others have allowed to kind of persist, even, against their own often stated standards and clearly, an enormous health emergency. And so I wonder if each of you, and Ethan, we can start with you since you've navigated this, very much kind of in your own family. And I imagine even pre-COVID, after your story became public, that you had people reaching out to you asking for advice. How do I have these conversations, with family, with friends, or, even in a more kind of public forum, kind of what have you found to really work to try to help kind of debunk the mis and disinformation or pre-bunk what kind of might be coming toward your loved ones? And just what advice would you have for kind of anyone who might be joining us today as they think about, gosh, maybe feeling overwhelmed, but still needing to persist because of what Hirsh said? If you're in this conversation today, you clearly kind of are mission oriented, you clearly want to make a difference. And so kind of just what advice would you have? And then we'll ask, Kelly and Hirsh to chime in too.
Yeah. And I'll try and keep it short because it's such a good question. I have so much I would love to say. But there's two sides of this. There's a medical professional and education side of that frustration you point to, and that feeling of irritation that, we spend so much of our lives and time and energy and thoughts working towards educating people. And then someone, says, oh, do 5G towers cause COVID? And we're like, no. And I understand that feeling of that almost kind of like I've spent so much time, studying and going to residency or studying medicine. And I spent so much of my life to educate you. And now my authority is being called into question. And I think a lot of medical professionals and researchers feel that frustration, but it's also it's not, we shouldn't have full authority to be trusted immediately. It's unfair to ask people not to be skeptical or questioning. And it's also unfair in a place of privilege even to think that way, because there's a lot of disparities socioeconomically on who has suffered in misdiagnosis and malpractice from medicine. We've seen in the African-American community, sometimes has disproportionately higher rates of these kind of like hesitant like thoughts or feelings towards vaccines, but it's also like they've been disproportionately affected by medical malpractice and misdiagnosis and these horrible things happening to them purely on the basis of race. So it's like, as an expert or as an advocate or as someone who works in this industry and field and like is trying to educate people, when we see people with these questions, see people misinformed or people that have latched on to bad ideas, what I say is take a step back and go, where are they coming from? You know, are they someone who is very socioeconomically disenfranchised? Do they like really live in a bad area? Or are they poor? Or do they have a bad experience with their doctor to where like they are more prone to think that like they shouldn't trust us? And that's where we need to like have an empathetic kind of building that relationship, that community oriented perspective. And on the other side, away from the medical side, is the family. And so the question of like, how do you engage with your family if they're misinformed? How do you engage with your parents, you know, if you're a kid who wants to get vaccinated? And it's a very similar answer, but the nuance here is that not everyone's going to change their mind. And that, as you pointed to, prevention is better than cure. And that's for medicine, but it's also for misinformation, because misinformation spreads like a disease. It reaches, you know, people that are a little more like prone to being like believing that on like even a physiological level. Some people like just believe things more easily. And there's also people that like have different experiences. And so it's like better to educate people ahead of time rather than like tackle the cure and say like, how do we fix this, you know? And that starts with you just advocating on a personal level and saying to your friends and to your family, like, hey, here's the research. I'm happy to back this up and talk to you about it and listen to you and like hear your questions. And you need to do that with a kind tone and like, you know, a smile, because that's what matters like the most, like truly. And I keep saying this like it, and it feels sometimes to me like so repetitive, but it's so true, because even my family, my mom will probably never change her mind. My mom will probably go to her deathbed thinking that vaccines cause cancer and all sorts of ailments. And that's tragic. But because I spoke to her with a kind and empathetic perspective, and I listened to her, I validated her concerns, but still maintained that she was incorrect. My brother, you're younger than me, my brother saw that kind of dichotomy and he was like, I don't really know what to think, but I like the way you're handling yourself. And that makes me feel more like safe to trust your judgment or to like believe you a little more. And my brother was not vaccinated, same as me. We didn't get any vaccines growing up. And when he saw those conversations between my mom and I, and me saying like, listen, I love you and I get it and I understand you're afraid, but still like the information is there and it's true and it's valid and you are just wrong. My brother heard that and he got himself vaccinated like after seeing these like conversations fly around. And my older brother, same thing. And like a lot of my family, same thing, because they saw just like the interpersonal love that I kind of had and the empathy. And that spoke a lot more than any of the data I ever could use. You know, people love people, not information. People relate to emotions and to like the heart rather than the, like these data points and these studies and these abstracts. Like that's what we need to focus on. You are muted, my friend, but I would love to hear
Thank
that.
you. One of my children's getting home from school, so I will keep muting myself so that you hopefully don't hear that loud cry of enthusiasm. Because for some reason, every time he gets home, he needs to go, I'm home. So my muting finesse may not avoid that, but if you do hear that, it's a 3-year-old with lots of enthusiasm. And then I just need your kindness and forbearance to remind me if I am muted. I think Ethan, you really answered the first question, which comes from Jim about kind of the best ways to counter misinformation from a place of empathy. But I really, hope that Kelly and Hirsh, you can also engage and maybe with some experiences from your own lives or from others that you've worked with that you really have seen kind of the empathy in action, but with an equal commitment, to kind of to facts and evidence, really help people be informed about kind of what is right and good for their health and the health of their families. So Kelly, please.
I absolutely agree with everything Ethan said. I think that was a wonderful response. Yes, I think there's sort of the level at which we talk about sort of prevention. And so where are these threads of misinformation coming from? What are the motivations behind that? And really there is a need to counter that in our society. And then looking at those individual conversations, I completely agree. I think it is about being empathetic. I think it's about listening and then asking questions. Actually, my favorite tool comes from a Unity toolkit. And it's for visits, but I think it with pediatricians, but I think it works really well. Just asking people what do you know about this vaccine, or sort of, if you just ask questions, you can really get to the heart of people's beliefs. So whatever it is, and then why do you think that? And sort of asking in a way that shows that you want to understand and see where they're coming from, really allows you to get to the root of an issue. And that way you can say, well, okay, well, I believe this, or sort of talk about why a fact might not really be a fact that they believe, or things like that. I do think actually the best piece of vaccine messaging I've ever seen, I actually saw while in college, and I used it for a rhetorical analysis assignment. It was an op-ed in the LA Times. I think it was called My Black Family, it's COVID Diary, My Black Family's Experience, something like that. It was actually written by a directing student, which was not where I expected best piece of messaging I've ever read to come from. But it sort of was because of that. And so he detailed in this piece, it was a daily diary essentially, or skips passages of time, but his experience with his mom and his grandmother having COVID and their beliefs, and sort of starting with this tense fight of them not talking because he wanted them to be vaccinated and they didn't want to be. But in this piece, he does an incredible job recognizing why they were hesitant, but also why these roots of sort of racial mistreatment and history we have in the US in particular of health inequities. The greatest thing we could do was to help, he wanted to counter that, was have his family be vaccinated. And so they really weren't a victim of this, and further victims. And so he talks about this through this piece, and it deals with his family and chronicles sort of world events. It's an amazing piece. I wrote a way too long essay, far beyond the word count about it. But I think this idea of recognizing historical roots, where sort of in a larger history, roots in larger history, but also roots in each conversation, where is someone coming from, why, and just asking questions and showing them that you're listening. So it isn't okay, yeah, but, and just jumping in and trying to tell them what's correct, why they're wrong. But understanding is ultimately a sort of conversation isn't productive if someone doesn't feel listened to and isn't changing their mind. And also it isn't necessarily one conversation, and there isn't okay, great, I changed it in one conversation, we're good to go. But I do think that there's a need to engage as well at a societal level of where is misinformation coming from, what groups are worse sort of at risk, and what we can do to change that.
I think a clear kind of through line in what both kind of Ethan and Kelly shared, and also kind of what was evident in kind of Hirsh's kind of first thoughts around kind of all of the work that he and kind of other medical and broader kind of health students engaged in, is that there is no kind of one a right way to have a conversation with someone. And that also often it's not one conversation, it is conversations, plural, over time. And I wonder, Hirsh, if you can reflect on kind of the question that both kind of Ethan and Kelly engaged with, but also answer a question that we have from Aya, which states, I'm torn about educating people who refuse to vaccinate. I've heard opinions saying, not to target them at all for messaging because it's a hopeless case. And I've also heard opinions saying it's not hopeless, but it takes a lot of time and patience. I think clearly we're hearing it takes time and patience, but Hirsh, what would you recommend? Do you think that time and patience is worth it? And what have you found to hopefully work through your time and patience?
Absolutely. Thank you so much for the question, Dr. Clinton and Naya. I think first, I certainly want to echo what Ethan mentioned about empathy and what Kelly mentioned about the fact that this is often more than one isolated conversation. And it's not just, I think, multiple conversations, but it's really a relationship that spans a great deal of time. And, this really is, I think, an age-old problem in medicine and public health. It goes back to the polio vaccines and what Dr. Salk had to do to overcome misinformation. But the polio vaccine, we've seen it with the MMR vaccines and with Andrew Wakefield and some of the misinformation that he published. And, when in those kinds of cases, it can be especially disheartening when you see physicians and experts be the ones to spread some of this misinformation. And so this is something that I think we have to grapple with in the context of COVID, but we also have to grapple with this in the long term, because this is always going to be a challenge that we have to overcome. There's a quote I'm fond of, that medicine moves at the speed of trust, and I think that's even more true for public health. And so I think I'll start with the questions about countering misinformation and inoculating people from misinformation. Then I'll turn to the question about educating people who may be relatively set in their ways. And so I think when it comes to countering misinformation, I've really seen the importance of a relationship with trusted messengers. And I think for many people, the most trusted messenger is often their primary care provider. And so having a primary care provider that you trust and that you have a good relationship with, I think is one of the most protective factors that any individual can have against misinformation. But we also have to recognize that for many people that relationship might not exist. And so it's important that there are a variety of trusted messengers, and that we try to encourage those relationships with the trusted messenger, whether the trusted messenger initially is an adolescent or a teen in the community, or whether it's a religious or spiritual leader, whoever it might be. That relationship with the trusted messenger is so important, and it speaks to the importance of not just the message, but also the messenger. But when we think about the message, I think in those conversations, it's helpful to try and draw out all of the reasons that an individual might have for being hesitant or not wanting to get vaccinated, and to do that in, as Ethan mentioned, a non-judgmental, empathetic way, to draw out those reasons. And in that conversation, I think by using open-ended conversational tools like reflecting and summarizing and encouraging the individual to share more, we can hope to understand the values that underlie a person's decision making. And so in that initial phase, I think it's really a focus on listening and understanding and identifying those values, because that really shapes the message. And the message, I think, does need to connect on that, as Ethan mentioned, not just the informational level, but that underlying value, being able to connect with someone on their values, because the message looks different if someone really values protecting their family, or if they value protecting the elders in their community, or if they are more interested in kind of the individual protection that might offer. And so when we connect on that values, I think it opens the space to push back in a way that still feels like we are all engaged in the best interest of the individual, and we are taking the time to understand what is important to that individual, and framing our message in that way. And I think that is more likely to land. And I think we've talked about how we can balance empathy with still staying on the path of truth. And I think it's important for us to meet people where they are. And so for some people who are in a place where they are really pre-contemplation, and at this conversation, they're not really open to thinking about a different decision, we do need to, I think, in that situation, sometimes prioritize the relationship and maintaining an open door, so that if that person later moves into a stage where they are more open to the conversation, that they're willing to come back to you and feel that it's a place where they can ask questions without judgment. At the same time, I think when we sense some openness and some questioning, that really is an opportunity that we have to take to push back on misinformation. And I think we can do that with information. Like Ethan said, I think there's a lot of work to be done in making science more accessible. One of the areas where we found success was trying to take the original primary literature on these COVID vaccines and present it in a way that's accessible, and make it possible for individuals to engage with that data themselves. And for some people, I think that can be very helpful. For others, that is less likely to move the needle. And And so I think we still have to be willing to push back on the misinformation and encourage people to connect with the resources that might help them, whether it's being able to engage with the literature, whether it's simply connecting them with a spiritual leader or a primary care physician. And I also want to mention one more quick thought on making science accessible. I think one of the changes we've seen during COVID-19 is that a lot of more physicians are willing to be active on social media to counter misinformation and engage in dialogue in areas that previously it may have stayed away from, in the public square. I think that is also very important to have trusted messengers who are willing to leave the ivory tower and do the work to try and make this information accessible and to directly engage with people who are spreading misinformation. And I just briefly want to turn to the question we have about the cases that may seem hopeless. And I think in coming from a place of empathy, no situation to me is hopeless. I think we can have the discussion about in a public health context when we're thinking at the population level, we can have the conversation about where our efforts are best spent, where we may get a more likely return for the effort. I think those conversations make sense at the population level in the public health context. But in the individual context, where we're hoping to build that individual relationship between someone and a trusted messenger, ideally a primary care physician, no person is hopeless. And I think while it can be difficult and taxing, and it can feel that we're putting in so much time and effort and not seeing the openness that we want to see, I think sometimes we might not realize the impact that we're having by being empathetic and non-judgmental. And we may think that nothing has changed in that person's mind, but it's a series of those small instances that I think can cause people to open that door just a little bit. And that really is the start of it. And so I would encourage everyone, I know it's difficult work and it can feel hopeless, but no person is hopeless. And I think we have to believe that we can reach them, even if it takes a long time. And this is a long game. Even if they ultimately never get the COVID vaccine, there will be other vaccines, there will be other public health campaigns, and we're going to need that trust and that relationship. And how we handle these conversations, like Ethan said, is a big part of building that trust, even if it isn't in time for this emergency. It is a long game. Building trust is a long game, and it's important that we keep trying even when it feels hopeless.
Well, and certainly I think, excuse me, as we heard from Ethan's example, even if he hasn't persuaded his mom to get vaccinated, his brothers were listening to those conversations. And so there's also a halo effect of kind of how we engage and also kind of what we say, in those conversations. And we have another question that's really centered on young people. And so Kelly, I'll start with you. For young people, what are the top insights you have in terms of what kind of information, resonates, excuse me, with this group? I'm sorry. And how does that differ across geographies or other demographic groups?
Yes, I think sort of varying stages with varying information. I know Ethan and I actually just did a webinar about college students together. And that is a very specific demographic. And I'm now in my second year of college. And I've sort of intimately got to know, I think. And so I think there's a common theme of arming people with information and a desire to be included in conversations. Obviously, young people have a huge role in increasing vaccination rates, whether it's with a parent who maybe is not pro-vaccine, but it also may be parents are busy, there's so much on their plate, maybe a well check for a child was missed, something like that. Like obviously a young person can be one to be like, hey, I need to get my second HPV dose, and sort of be an advocate in that way. So I think sort of the key thing to do for them is just involve them in the conversation. I do think that there is a need for lots of information that's easily accessible, that isn't buried within maybe a large public health department site, to find that like one specific thing you need It doesn't lean too heavily on medical information. Obviously, we want everyone to know the science, and that there's trust when you come sort of coming from showing people the facts. But I also think that we have to recognize that most of these conversations are not like, I'll send you an abstract, you send me one. They're happening at the dinner table, they're happening at lunch, at school, and sort of making it in a way that everyone feels that they understand what's happening. I think we've all had conversations where we don't know what's going on, we don't understand what someone's explaining, and we become very closed off as a result. And sort of that empathy and making sure everyone can participate, no matter what age they are, what perspective they bring. And I do think that with COVID, this has become like a daily conversation. I think it's in college, for example, I think college students are a great group to target, to be completely honest. I not only did I have to sort of log my COVID vaccine, and we talk about COVID all the time, and see a huge impact on all of our lives, especially like last year moving in, sort of the different experience of being in person and online school and all of these things. But also, like, I know all of my friends had to log their vaccine information for a normal routine vaccinations in our student health platform. And for many of us, like, maybe not me, most people who are not vaccine advocates, this was the first time that they've checked what vaccines they had and had to look, oh, this is the age I was supposed to have it. Have I had this dose? Such a sort of like strict format. And that opened at school so many conversations of, oh, wait, I realized I hadn't had this, or, oh my gosh, I missed this dose, or I've had this, have you? And then there's student health, which has all of them and has them for free, hopefully, at most colleges. And so I think there's a need for accessible information, for empathy. Accessibility means both easy to find, it's also there, so meeting people where they are, whether that's in a science class, health class, etc. Information that everyone can understand as well. And just making sure that people who have these conversations just or happen to are equipped and have heard, they don't need to just go look for something, but they've heard it in whatever class as well, what they need to say.
Yes, Kelly, the number of people who, after we had confirmed polio here in New York, reached out to me and were like, am I vaccinated? And I was like, well, you should know the answer to that, but let me help you find your answer to that happily. Ethan, I wonder, what you would want to add about either the college kind of demographic, since you're also in that demographic. And as Kelly shared, you were just kind of on another webinar speaking about that, or kind of, even for younger teenagers, anything that you also just, want to share with the group here today.
Yeah, for sure. I would say that the good thing to think about in terms of like the sociological perspective of how do you reach these demographics is what do they care about? Because if you just assume they care about vaccines, you're wrong. A lot of people spend a lot of time at work, a lot of time with their friends, a lot of the time at school, and that is what their priorities are kind of focused on. It's like their day-to-day demanding, their normal life. And vaccines are typically not a part of that. Vaccines typically for most people are an interruption to that part of their life, where it's like, hey, for the semester go to school, you gotta get your vaccines, or hey, to go to this daycare, you gotta have your kid vaccinated, or like, hey, by the way, make sure you get your shots this year. And that's really all it is. So the good thing to ask is, what do these demographics really care about? What are their concerns? What are their fears? What are their stressors? And how can vaccines address that in a way that's relevant? And so for younger teens and kids, they can't usually, depending on the state you're in, make the decision to get themselves vaccinated. Their concerns typically are, school, social life, drama. It's teenager stuff. Like, being a teenager isn't complicated. I've done it. It's pretty true. And like, truly, no one really cared about vaccines. And so the thing people cared about, though, was that, in a conversation where I was in, or my friends were in, where someone said, if you don't get vaccinated and you get sick and bring it home to your grandparents, they could die. Whoa. Now, like, the room is listening. Now people are like, okay, if I don't get vaccinated and I give someone another disease, that could be really bad, transpose that sickness. And I have a personal responsibility to make sure I'm taking myself and my health decisions with a sense of, adult maturity. It's not just it doesn't matter. And especially when you're in a school environment, you're in public school, you're around a lot of other kids. I had baby siblings when I was in high school. So if my two youngest siblings got measles, that'd be really bad. And that was the driving force for me to get vaccinated. It's a driving force for a lot of younger people to get vaccinated, because like you're so surrounded by your social atmosphere and your family that like that's a really tangible thing to latch onto. If you're a college student though, it's no, like I said this during this other panel, it's no like secret that college students are broke, and like I'm one of them. And so like vaccines will save me money, and that is like a really good way to like convince me to get vaccinated. Because like if I'm sick, you know what I'm gonna not be able to do? Go to work, and that's not good. And like that is a thing that like I've said before for also for college students in school. You know, if you're sick, what do you do? Go back to online classes or listen to recorded lectures. No one wants to do that. And like, no one wants to like isolate themselves inside of their prison cell they call a dorm and like to be sick all day. And so it's like, those are really tangible things to say, like, listen, if you like don't really care about getting vaccinated, that's fine. But like, consider like the consequences that follow. That's a really like, I focus on that in conversations. And so if I have like friends that are in college who aren't really vaccinated, I'm like, listen, dog, if you get COVID and you're going to be sitting in your room all day listening to like recorded lectures and sneezing into your pillow, like have fun. Like I'm not jealous for you. And so that's like, and like there's facts to back that up, right? Those claims aren't like just fleeting like statements. It's like how it really is. And I think that like our advertisements, our kind of like messaging, our public like perspective on vaccines, that's something in the previous panel I advocated for. We've seen like commercials for like anti-smoking, where it's like, if you smoke, you know, you're a loser. And it's like, that actually kind of works. But when it comes to like COVID vaccines, a lot of the COVID vaccine like commercials we see online are just like people frolicking through like a daisy field. And it's like, go get your vaccine. It's like, okay, cool. But if we had like as something on TV, there was an ad of a kid stuck in their dorm watching a recorded lecture, and they're like sneezing into a pillow, they're wrapped in a blanket, and they look miserable. And it's like, you don't have time to get COVID. Like, school's too demanding, get your COVID vaccine. Like, I honestly think that'd be kind of effective messaging. And so that's like my perspective is like, you know, what's a demographic? What's their stress? What is their concern? And that flows to everything, even like communities that are more prone to misinformation, like the religious communities around different like large faiths, like the Orthodox Jewish or Christian community. Their community could be devastated by an infectious disease because they're so ingrained and close to each other and congregating and like worshiping together. So it's like you, like God loves you and all of your other like people in your church. The empathetic Christian thing to do is to get vaccinated, right? And like, why would you care if you're a Christian? Because you love your community. That's your priority. So I just try and really go back to the fundamentals.
Great. Thank you so much, Ethan. I'm mindful of our time. Hirsh, I wonder, if you want to share thoughts either on this topic, or also we had a question focused more on kind of events as a way to help kind of reach people with good information and hopefully help protect people from bad information. You clearly have helped organize quite a number of communal and kind of public events at various points over the last few years. I wonder, is there anything that you want to share kind of from your experience, or that you've seen kind of really work for your friends to try to help ensure that events are a place where good information is shared and not mis or disinformation?
Yeah, thank you so much for that question, Dr. Clinton. I think in terms of events, there are a few things that we've seen are helpful. So first, I'll return to the importance of the message and the messenger. And so I think when we think about the events, the place to start is often to think about who that trusted messenger would be. And so, for example, we hosted an event in a Sikh community in California, and we knew that the community would have religion-based questions around what the right decision should be. And so we really prioritized and were able to find a Sikh physician who was able to come and advocate for vaccination and answer questions and connect on a spiritual level and have those shared values that come with being a part of that community. I think that's sort of an ideal case, and there are going to be cases where we can't quite find such an ideal messenger. And so I think in those situations, we can think about who is that first trusted messenger who can introduce and vouch for a secondary trusted messenger. And I think we've seen this with great partnerships with, again, spiritual and religious leaders who maybe themselves, don't consider themselves to be the experts who can, answer all the questions on vaccinations. But if they are sponsoring the event, bringing their congregation together, and then introducing and vouching for someone who they believe is a trusted messenger and who they are willing to vouch for it, I think that can go a long way. And so I think the first thing with the events is to really think about who is the target audience and who is the target audience going to trust immediately. Because building trust is a long game. So if you can start with someone they already trust, that's going to make the event much more likely to have an impact compared to if a good deal of the event is spent just trying to get that initial trust. And I think once you've identified that trusted messenger, then I think you start to think about how to build the message. These are a lot of what Ethan said. And so thinking about what is important to the community, what are their stressors, and what sort of values do they hold? If appealing to protecting elders, protecting family, which of those messages might resonate the most. And so I think those are some of the thoughts that go into planning that type of event. And then another lesson that we really drew from hosting kind of online webinars with Q&A sessions is that a lot of the feedback we got was that the Q&A portion of the event was by far the most valuable. And so as time went on, we started shrinking the presentation. The presentation had been intended to take primary scientific literature and make it accessible at a third grade reading level. And we started to condense that presentation, leaving more and more time for Q&A. And the feedback we got was that is what often moved the needle for people, was being able to ask their questions and to be able to get an accessible answer that still was grounded in the science, but was accessible. And also in cases where the question went beyond what we might have prepared, a willingness to do the extra digging and research and get back to that individual with a more comprehensive answer than maybe what we can provide in the moment, I think is also a good way to build trust. And so those are, I think, some of the lessons that we learned around hosting events. And I think we did a lot of them virtually, but I think when it's possible to do them in person, you can also have organic one-on-one conversations that occur after the event. And I think that's really powerful, because as much as we can tailor a message to a community, community is made up of individuals, and we really do want to be able to connect on that individual level as well. And then one last piece that I'll just mention, I think we have talked about misinformation, and I think I also wanted to highlight cases in which true information is used in a way that is irrational. And so, for example, a lot of times we hear discussion about certain side effects and risks of the vaccination. And one that I think has been in the news is myocarditis, which is a heart-related side effect. And one of the things that I think provides helpful context there is to compare the risk of vaccination to the risk of COVID-19. And that's one place where, I think there is still some ongoing debate about, what the risk might be from the vaccination, but there is no debate that the risk of myocarditis from the vaccine is far lower than the risk of myocarditis from COVID-19. And so I think sometimes we certainly need to be able to push back on misinformation. We also need to be able to bring things back into the context of comparing different risks. And so I think a lot of times information can be weaponized by focusing on things out of context. And we always need to be able to bring it back into the context of what we're trying to prevent. And, as Ethan said, what COVID-19, the type of impact that it can have, and to bring the focus back on what we're trying to prevent. And so I think those are hopefully will help with the events, but it really just comes down, I think, to customizing the messenger and the message to the individual community and the individual people. And so it's hard to give an an answer that will work for every type of event. It's really about knowing the audience and finding the right message or the message for that audience.
Well, Hirsh, thank you so much. And thank you to Ethan and Kelly. I know we are now up against time. I certainly hope that if anyone in the audience has kind of more questions, they'll reach out to all of you directly to learn more about kind of your work, your organizations, what you're doing. And I now want to hand it back to Judy and just say again how grateful I am to kind of be in partnership and community with Unity. So Judy.
Thank you so much. And thanks also to our panelists, all of our participants for their active questions. Of course, my Unity colleagues for making this all happen. As you hang up, if you could please take a moment to complete the brief survey, and of course, check out our website for more information and resources. It's unity4teenvax.org. Check your email for panel highlights. And Dr. Clinton, thank you so much for your continued support, partnership, and I love that word, community. Everybody have a great, great day.